Hello? Is everything? Okay, awesome. All right, so I am co-host. I think Tiffany is the host, or who's the host? Who claimed being the host?
Can you say that again? I didn't have my earphones on.
Okay, no worries. So who is the host at this moment?
It says I am,
Okay, all right.
but I don't have any options to change it.
All right. I was going to say, so yes, it is recording because it automatically records, but I think, okay, wonderful. So, let me kind of start. Hello, everybody. Thank you for joining us for the immunization and insurance webinar session. I'm so glad for you to join us today. We will be learning a lot of information about immunization requirements and insurance-related issues on getting you prepared before you come to the US. We were able to have wonderful people join us today, knowing that immunization and insurance is one of those things that a lot of you seem to have questions for. So we have some folks from the Student Health Services Office and also from insurance that will introduce themselves and present and also leave some time in the end for a Q&A. So if you have questions, please make sure to stay till the end to ask them. They kind of work in the student health office, so they know a lot about kind of specific questions that they can help with. All right, take it away.
All right, my name is Shannon LaPlante Hawley. I am the immunization coordinator at Mason, and I will be presenting about the immunization requirements. And I also have Tiffany Leitner with me. She will be answering questions in the background, so please use the Q&A to ask any questions. And if we get asked the same question too many times, we will wait for the Q&A to answer everyone at the same time.
Good morning. My name is Pat Haggerty and I work in the Aetna Student Health Insurance. So I will be discussing the insurance. And if you have any questions, please feel free to ask me.
All right, and like she said, I'm Tiffany Leitner, and I'll be helping you with your questions in the Q&A.
All right, so let's begin. The objectives of this presentation are to learn more about the immunization requirements, how the health insurance enrollment works and the waiver process, important deadlines, and then we will answer your questions at the end. Go to the next. Okay, all students who attend the classes on campus are required to submit immunization records. If you are an online student but living on campus, you're also required to submit immunization records. These are requirements from the Commonwealth of Virginia, as well as the university. This is very important to keep you and your university community healthy. Keep in mind, the following dates are important. The records must be received before these deadlines to complete and be complete to avoid the penalties. August 1st, this is the first deadline to submit immunization. This date has no penalties, but this allows you to complete the requirements and for us to process your records prior to arriving on campus and interfering with your classes once you arrive. The next deadline is September 9th, and if you do not meet this deadline, you will incur a $50 late fee, which cannot be waived. The final deadline is October 1st. If we do not receive the completed records, including additional doses needed, if due, or paid the late fee by this date, you will incur a hold on your Patriot Web account. This hold will prevent you from registering for your next semester classes, dropping classes, as well as receiving your I-20 at the end of the semester. Once your records are received and complete, and you have paid the late fee, we will remove your hold within 24 to 48 hours. Please go to the Student Health Services website, shs.gmu.edu, click Immunizations and Forms, or another way to find the form. The student will complete pages 1 and 2 and 5 if necessary. The provider will physically complete pages 3 and 4. They must add the dates you are actually receiving the vaccine. Check marks are not acceptable. It will not be accepted if it's completed by anyone other than the provider. Next slide, please. Finding your records. There is multiple ways to find your records. I'm sure that you have received some of these vaccines as a child. Places you can check for your copies of historical records: hospital, doctor, medical provider, previous university, high school if you attended in the United States, family records. These must be signed off by a healthcare provider. They can't just be a booklet that your parent or guardian wrote the dates in. Childhood records, same thing. They must be signed off by a healthcare provider. All records or documents you submit must have your full name and date of birth, must be on a provider's letterhead, must be in English, the entire document. If it is not, you will need to have it translated by a certified translator. Visiting a healthcare provider. Take the George Mason immunization form to your healthcare provider. Provider must physically complete, sign, and stamp the Mason immunization form. This is what we call a transcription. They will take your childhood records you provided them or the records they have in their office and transfer them onto the Mason form. The reason you're visiting with the doctor, they will review the records, and then if you are missing any requirements, they will administer the vaccines or give you a TB test to complete it at the time. What immunizations are required? A TB screening. Page 2 of the immunization form you must make sure that you answer all the questions. If in your lifetime you have lived or were born outside the US, please provide the country or countries that you have lived or visited. Write on the line next to the question. Please make sure you answer these questions correctly. TB testing. Based on the answers to the questions on page 2 of the Mason immunization form, you will be required to have a TB test. If that test should come back positive, you will need to have a chest x-ray dated after the positive test within 3 months of classes starting. For fall, that would be May 1st of 2024. You will need to submit a copy of the chest x-ray report. Please don't upload a copy of the x-ray itself, as we can't read those. Hepatitis B series, you will have several options to complete this. You can submit documentation of the hepatitis B series, submit a positive blood test report, or sign the waiver on page 5 of the immunization form. The MMR, which is measles, mumps, and rubella, that is 2 doses of the vaccine or a positive blood test report. Meningococcal type ACYW, this is not the same as the recommended vaccine meningococcal type B. They are completely different. The required vaccine meningococcal type ACYW must be administered after the age of 16. If you are over 22 years of age, you are not required to have this vaccine. If you are between the ages of 16 and 21 and don't want to receive it, you can sign the waiver on page 5 of the immunization form. Tetanus diphtheria requirement. 1 dose of the tetanus diphtheria acellular pertussis is required and must be dated after your 11th birthday. And if that is more than 10 years ago, you will need documentation of an additional tetanus, diphtheria, or tetanus, diphtheria, acellular pertussis within the last 10 years. The recommended vaccines, the following vaccines are recommended. You do not need to receive them if you have not already received them, but as it states, they are recommended. COVID, hepatitis A, human papillomavirus, meningococcal type B, and varicella vaccines. Submitting the immunization form, you will scan or take a picture of each page of the Mason form. If you are able to scan as one document, please make sure it fits within the size parameters. You can see the size parameters on the patient portal right above where you can upload the documentation. You will go to the patient portal by going to the Student Health Services website, log in with your Patriot Web credentials, which is the same as your George Mason email login information. You will need to set up your two-factor authentication to access your account. Once you log into the patient portal, you will click Upload on the left-hand side of the menu. You will read the instructions and make sure that the file name and size of the file meet the parameters put in place, such as the name of the file cannot be more than 60 characters and cannot have anything but numbers or letters. Once you upload the document, you can scroll all the way to the bottom and see exactly what you uploaded. If it does not appear on the screen at the bottom, something did not work. Please make sure you follow the steps. If you have any issues uploading, you can reach out to the portal IT for help. Go to the link on the screen, scroll down, and there will be a form for you to add your information for assistance with your upload. Checking your status to the patient portal. Please allow us 7 to 10 days to process your uploads. Please don't send us an email immediately after uploading your documents, as it does take us time to process records. Once your records have been processed, you will receive a message within the patient portal under messages. If your status is complete, you will receive a message stating so, and you will be done. If your status is incomplete, please read the message carefully, as we will give you all the information you need. It will explain what is missing or why we didn't accept something you gave us. Could be the patient information was not on the form you submitted, or you didn't have a certain vaccine, or your documentation was not in English. If you are unsure, please contact us via email or phone, which we will share at the end of this presentation. The next few slides are going to be some frequently asked questions, which you can also access on our website. Can I get all the vaccines at Student Health Services? Yes, students can get all the required vaccines at Student Health Services. First, you need to make sure you upload the George Mason form with at least student sections completed, which would be pages 1 and 2, and 5 if you want to sign the waivers for Hep B and meningitis. After you receive the secure message, please give us a call and schedule an appointment. Closer to the deadlines, appointments fill up quickly, so please do this as soon as possible. Vaccines can take multiple visits, so please plan accordingly. What is the cost of the vaccines at Student Health Services? All our fees are on the Student Health Services website under the tab labeled Fees. If you have the Aetna Student Health Insurance Plan, required immunizations received during the plan year are covered at Student Health Services. That means you will not pay out-of-pocket fees for the cost. For fall of 2024, the plan coverage begins August 16th. If you have another insurance plan, or if it is outside of the plan start, you will be a self-pay and you will have to pay the vaccine fees. If the vaccine is not available in your country, what if I started the vaccine series but cannot finish the last dose before I leave? It's okay. Submit the vaccine documentation that you do have. Once you arrive to the US, schedule an appointment to get any missing vaccines. Where can you get them in the United States? You can schedule an appointment with us by calling the number to the immunization office, or you can get your vaccines at a doctor's office, pharmacy, or retail clinic off campus. Once you have received the vaccine or next dose, submit the documentation. Make sure that your documentation has your name and date of birth on it and upload it to the portal so we can update your records. What if I have a medical reason that prevents me from getting the vaccine? Your healthcare provider must complete and sign the Mason Certificate of Medical Exemption for Immunization Requirements. This form is located on the Student Health Services website under Immunizations and Forms. Medical diagnosis must be included, and it must be signed by a healthcare provider. Once it is done, you will upload it to the portal and we will forward it on to our executive medical director and they will approve it. If it is not approved, you will be required to get the vaccine. What if I do not have a healthcare provider who can complete the Mason form? You can request transcription service at Student Health Services for a fee of $20. You will fill out parts 1 through 3, if applicable, part 2 of the Mason Immunization Record form. You will upload the Mason form with your shot records and immunization documents to the patient portal. You will then email the immunization office, immunize@gmu.edu, to request a transcription service. In the email, please include your full name as seen on the George Mason Patriot web account and Mason G number. Then please include the phrase request for transcription service and include a written acknowledgement that you agree to pay the transcription fee. Can Student Health accept records in a language other than English? Unfortunately, we cannot. All records must be in English to be processed. You can search online to find a translation service for records. All documents must have your full name in English and your date of birth. Can I wait until I arrive to the US to submit my immunizations? We recommend you start on the steps to submit immunization documents as soon as possible. Find your vaccine records, start vaccines before you come to the US. If needed, you can finish vaccine series here. Submitting earlier allows you to avoid a late fee or an hold on your account. If you do need to wait until you come to the US, begin the process as soon as you can to meet the deadlines. If you need assistance or have questions, please call or email the immunization office. And I will go ahead, Pat.
Good morning. I'm here to talk about the student health insurance plan. All the basic information, all F1 and J1 visa students are automatically enrolled in the George Mason Student Health Insurance Plan. The enrollment is automatic and the charge will appear on your student account each semester, fall and spring and summer. Aetna Student Health is a company that provides the insurance plan. The George Mason Student Health Insurance Plan includes a comprehensive medical plan and vision is included. You can find all the information, the summary of benefits for the medical and the vision on our website. There is an enormous amount of information. And after reading that, if you have questions, please contact us. Dental insurance is separate. It is a separate purchase. Dental insurance can be purchased during open enrollment, which starts July 25th. If you want dependents, To have the insurance, you must be enrolled in the dental first, and then you can add them to the plan. To sign up, you enroll online through our website on the Aetna Insurance website during an open enrollment period only. That's the only time you can enroll. The waiver application process. Some students may have health insurance plan that meets the requirements to waive off the George Mason Student Health Insurance Plan. Any plan must meet our waiver requirements as listed on the insurance website. Must be from a U.S. employer or through an embassy. Meet the coverage criteria listed online. You could always contact us for questions, or you can also contact Into about a waiver request. Once you review the criteria online and determine your plan meets the requirements, you can submit a waiver request. Contact the insurance office to request a hard waiver for the health insurance plan. Staff will respond in 5 to 7 business days about the next steps you need to take. Waiver requests must be submitted by September 15, 2024. If you have a financial guarantee from your embassy, you must send that to the insurance office before September 15, 2024. Applications must be approved. August 16, insurance coverage begins. September 15th, for full insurance waiver request deadline. We cannot accept anything after September 15. July 2024, annual open enrollment for dental insurance or dependent enrollment begins July 25. September 15, annual open enrollment ends. When can you not apply for a waiver? National health coverage and or travel insurance do not meet the criteria for a waiver. If you have medical claims from any healthcare provider for services filed under a student health insurance plan, you cannot waive the plan. This includes student health services and services such as immunizations. Okay, our website is Insure, the email address, Insure, INSURE @gmu.edu. And our phone number is 703-993-2826. Our phones are open from 8:45 to 4:30, and on Friday it's 12:30 to 4:30.
Pat, are you done?
Yes, sorry. Yes.
That's okay. Does anyone have any questions?
All right, and just to let you know, whoever is joining us, the Q&A is it has a question mark. So click on that button icon to type in your question. If you don't want to type it, you can raise your hand. Click the raise hand icon. That's on the bottom. So we can unmute you and you can ask your question as well.
And Ward, there is a question. They want to know if the webinar will be shared after the meeting.
Yes. Okay, I can. So yes, it will be. We will have a recording of this that we will share for you to review or look at, because we did cover a lot of information. And you should, knowing that you have the link to this webinar, we have your email and we'll send it to everybody who received this webinar for a follow-up of this. Okay. So one of the things I should say in terms of questions that I've been getting from students who are coming in are asking if the immunization form needs to be fully completed before they enter the United States, thinking that if you don't complete it, then they will not allow you to enter the US. No, you do not need to complete it to enter the US. We just send you information on how you can be in your home country at the moment and prepare. Usually a lot of our students have doctors in their home country, and they can explain it to them in the language that they feel most comfortable in. So that is why we are letting you know early, so you can talk to the doctor, your home doctor, and they can help you fill out the form. In terms of translation, a lot of students are asking their records from when they were younger, when they were children, is usually in maybe a different language. So if your immunization records are in Arabic, are in Chinese, Korean, you need to get that translated into English. And like mentioned in the webinar, you can find many translation places that are certified where you just upload your documents and you pay a fee, you pay some money, and they will return it to you in English and stamped. So that works. Okay. Then there is another question over here that I'm looking through some of the questions that I'm getting from students. One of the things is regarding do I have to sign up for the student health insurance? So all of the students, all of Into Mason students have the health insurance automatically included when you pay for the tuition. It is part of it. We do have, if you are a sponsored student, as mentioned in terms of Ms. Patricia was explaining, that you could waive that process because you have a different insurance provider. Is it possible to show how they can access their card for their insurance?
Yes, they just go to www.aetnastudenthealth.com, go on to George Mason, and they'll see they just enter a G number and their date of birth, and they should come up with their health insurance card to print out or to add to their phone. If they have any problems, just contact us and we'll help them through it.
Okay, so it will be a digital card. It's not something they will receive by the mail.
Yeah, they can call Aetna and ask to have a physical card mailed to them if they wish.
Okay. All right, great. So we will also kind of cover that during orientation to show you if you want to have kind of a copy of that card, we'll explain it to you. But during the immunization, the forms that we've shared in the emails, please look them over. There are several pages that you have to go through, and some of it you need to fill out, and some of it you need to have a doctor or a healthcare practitioner fill it out for you. So one of the things is, as mentioned, if they fill it out, just make sure they fill it out in English. Okay, so we did have some students have their doctor fill it out in a different language. It needs to be in English. So that's kind of one of those things I would like to mention. And then let's see over here. Okay, we have a question about in the chat as well. Okay.
So yeah, that's about the transcription. You need to take, it is recommended that you take the George Mason form and your US high school shot records and any other shot records you may have to a provider so they can transfer it onto the George Mason form. Yes, you can bring it to the George Mason Clinic. Physically, no, you do not need to bring it to us. You upload the George Mason form with your portions filled out and a copy of your shot records to the portal, and then email us that statement. I acknowledge and request the transcription service and agree to the $20 fee to the email address immunize@gmu.edu. And then we can perform the transcription for you. But again, it is recommended you do that prior to coming to the US and before classes start, so that way we can get this done and you don't have to interfere with your classwork.
All right, wonderful. And as mentioned, you do have a little bit of time before kind of you get the late fee. So when you come during orientation, we will cover filling out the immunization form if you need extra help. But when you do come, it's usually better to plan ahead because some of the times you might need vaccines that you need to take time, you need to space them out. So sometimes you might need something with like 2 or 3 doses. So you need to wait a little bit before you take the first one, and then the second one, and then the third one. And then if you also need to do like a TB test, you also need to plan for that. So when you upload things to the portal, now that you activated your Net ID and can enter, it will show you kind of, you have to upload each page by page. You will get an email showing you step by step. And also the Student Health Services website is helpful. It has a video that we'll try to include also in the email for you to look over and be able to understand how to upload the forms. Okay, and I just want to let you know all that it's for a lot of our students, it's not uploading it the first time. You probably might need to upload it more than once. You will get messages from Student Health saying what you are missing. So it is very normal and okay. Don't feel frustrated if you keep getting messages back saying something is missing or something is wrong. It does take a little bit of time, but thankfully for this process, it's only you do it once. For the most part when you enroll, and then you don't really need to do it again unless you have something that requires for you to do a follow-up. But it's usually one of the things that students get scared about. But we're gonna be here to help you so you're not super scared about it. But just know that it does take a little bit of time. And a lot of our students, it's not easy for them to understand some of the things we're talking about, and that's okay. That's why you have our email. And then when you come also during orientation, you will have orientation leaders who are students like yourself, and they can explain it to you maybe in your language. And we can sit with you and help you fill it out. Okay? All right. Now it looks like we'll leave a few minutes for final questions. And then I also want to kind of give time for our panelists. If you have any terms of things that you've found or realized with students from Into Mason that you would like to point out, it would be a good time, and we can think about it later on, especially during orientation, and how we can help our students.
One thing I did notice, and I don't know if it's into students, just in general, students, when you upload the immunization form, please only upload it one time. We are getting it to where students are uploading each document 5 times. So we're getting one document with 5 pages, 5 times each. So that's, 5 times 5, that's 25 documents that we have to review. So that does take a lot of time for us to review each of those documents. So please make sure that you are mindful of the documents you are uploading. If you upload the George Mason form, all 5 pages in one file, you do not need to upload it individually as well. Just one time, what you see is what we see. So please, if there's 10 documents to 10 file names that you can find, you only need to do it one time. So as long if 5-page document, one file, that's okay. You don't need to do it all the other ways. So anything you can think of, Tiffany, that you've seen recently?
I think that is the main one. It just definitely causes a lot more work and slows us down in processing your records. And I'm sorry, I was answering questions, so I didn't hear everything, but After you've uploaded documents, just allow some time for that. Don't feel like you need to email us to tell us that you've done that. We do see that the documents have been uploaded. So just allow some time for that because we are human and we have to take our time to do these things so it doesn't get processed immediately. Right now, I would say give us at least 1 to 2 weeks to get everything completed for you, and we will notify you as soon as it's done in a secure message.
If I could just go over a few things. Remember the important date is August 16 when the insurance begins. If you need to enroll a dependent, you have to wait for open enrollment, which starts July 25th. If you are unable to do it from our website, please contact us and we'll help you through that. The dental insurance is a separate purchase. You must enroll if you want to during open enrollment. That's the only time it's going to be available. So if you could just remember that, that would be helpful for you.
All right, great. And can you explain a little bit what dependents mean for someone who's not familiar with that term?
Sure, dependents is your spouse or any children, and you can add them. You can also, if they are not coming into the country until say October, you can still add them to your plan. Just contact us and we'll help you through that.
Okay, wonderful. So just spouse, so husband, wife, or children. Does not
Yes.
include brother, sister.
No,
Okay.
just spouse or children. Thank you.
Yes, all right. That's a term. And so with insurance, one of the things is if you have Aetna insurance, which is the university's insurance, you could go to the student health services, the clinic at the university. And during orientation, we will take you and show you where that office is. It's on campus. But when you do appointments and you can't seem to find an available appointment, Aetna insurance allows you to find other doctors that take that insurance. I think that's correct.
Yes, just contact us and we'll help you. We are not in the office, we're virtual. So they will have to email us or call. And
Oh,
we'll be more than happy to help them.
all right, wonderful. So yes, student health services, we have nurses and doctors at the office in the university. But insurance, you need to kind of call or email and they will get back to you. And then for sponsored students during orientation, we will have a separate session to explain how to navigate your own insurance that's not connected to Aetna. It could be something else. So yeah.
So I also would like to mention that the immunization office is virtual as well. We are not in the office. So if you have any immunization questions, please call or email, and we will get back to you as soon as possible.
Okay, wonderful. There are people though there, but just to call or email first.
Right, the admin offices are not there, but if you physically need a vaccine, it is done in the office.
Okay, we don't have yet virtual vaccines. Okay, yeah, just making sure. Technology. Okay, so yes, then we will, if you have kind of those questions, please do email out to the immunization office. If not, you don't know who to go to, please email into EXP. That's the email you've been getting messages about webinars, sessions, and things in terms of orientation schedule. So email back and ask your questions and we will help you. I also have kind of a thing where we're having students come in a bit early. Are they able to book appointments before their insurance begins? Like ahead of time?
Yes, they can book their appointments before August 16th, but the vaccine, they will have to pay for any testing or vaccines they get because their insurance doesn't take effect till August 16th.
Okay, and there's no like reimbursement process, just to clarify.
Claire, yep, exactly.
No.
Yeah.
Okay, wonderful. All right, so I did already have a question with that. So yes, it is, like I said, there are many components to the immunization. During orientation, we will take you through step by step, but we also wanted to let you know that you can start now. And the sooner you start, the better, because as everybody here mentioned, the time when you come during orientation and then start classes, you will have a lot of things to do. And so if you start early, that allows you to be able to take at least a little bit of it off, because doing appointments and you having classes and trying to find a doctor, it takes some time on you and it could be stressful. Okay. So we want to make it as stress, in terms of stress, a lot less than what you would normally do if you leave it all to the last minute and you're working with a deadline. All right. So if everybody thinks they've covered things that they would like to point out and mention, I think we are good. No more questions, it seems, from the Q&A. But like I said, after you go over, look through the immunization form, look or connect with your doctor, and you do have additional questions, please reach out to the intoexp@gmu.edu email. And we will try to help you in figuring out if there was something missing or what you still need to do. Okay. All right. So thank you so much all for joining in on this webinar session. We will be sharing this also recording with everybody who attended and who couldn't attend because of the time difference or whatever reason. But I also look forward to seeing some of you during orientation week for also figuring out or meeting with students as well. But thank you so much for joining us, and we hope to see you soon.
Have a good day, everyone.
Thank you. Have a good day.
Bye.
All right. Bye.